My name is Dr. Elena Voss. I'm 38 years old, and I have held a beating heart in my hands without my pulse rising above 72. I have reconstructed shattered femurs at 2 a.m. while the rest of the world slept. For 12 years, I have walked these hospital corridors in silence, letting my work speak louder than any voice ever could. Until the day they decided my silence was the problem. It was a Wednesday afternoon in the orthopedic wing of St. Agnes Medical Center. I had just finished scrubbing out from a routine knee replacement when the chief of surgery, Dr. Harlan Reeves, asked me to step into his office. My ex-husband, Dr. Nathan Voss, chief of anesthesiology, sat there already, looking appropriately concerned. "Elena," Harlan began, folding his hands like a man delivering bad news at a funeral. "We need to talk about the Whitaker case." Thomas Whitaker, 62, prominent businessman, high-profile knee and hip revision surgery that had gone wrong, infection, implant failure, and now he was facing a second surgery and possible permanent limp. The family was furious. The hospital board was nervous. And somehow, the narrative had already settled on one conclusion.
Nathan
Dr. Elena
didn't
Voss
look at me.
was too cold,
He studied
too
the corner of
detached,
the desk,
too
as if the wood
mechanical
grain
under pressure.
held answers. "I've reviewed the notes," Harlan continued. "Your focus during the procedure seemed distant. Several nurses mentioned you barely spoke to the team. Nathan has expressed concerns that your personal issues may have affected your judgment. I felt the thin silver band of my grandmother's watch press against my wrist, the one she gave me the day I matched into my residency. I ran my thumb across it once, the way I always did when the world tried to rush me. Is that what you believe?" I asked quietly. The question landed softly, the way a scalpel does when it finds the right plane. Harlan blinked. Nathan's jaw tightened. Neither answered. 5 minutes later, as I walked out of that office, I already knew what I was going to do. Not because I was angry. Anger is loud and wasteful. I was going to do it because the truth, once uncovered, has a way of speaking for itself. Let me take you back. I grew up in a quiet town in upstate New York, where winters were long and opinions were longer. My father was a mechanic who fixed what other people broke. My mother taught middle school math and believed in showing work, not just answers. I learned early that competence didn't need applause. It needed precision.
I met Nathan during residency. He was charming in the way anesthesiologists often are. Calm voice, steady hands, the ability to make terrified patients feel safe before they drifted off. We married in the hospital chapel because it was convenient. For 8 years, we built what looked like a perfect medical marriage. 2 surgeons under one roof, respected, busy, childless by choice. Or so I thought.
The first cracks appeared after I was named lead surgeon for the orthopedic trauma service. Nathan had wanted that position. He smiled at the announcement party, but his eyes didn't. Over the next year, the comments started. Small at first.
"She's brilliant in the OR, but bedside manner could use work."
Elena is intense. Not everyone can handle that. Sometimes I wonder if she even feels what the patients feel. I heard them secondhand. I never responded. I simply kept my head down and my outcomes high. My complication rates were among the lowest in the region. That should have been enough.
It wasn't. When the Whitaker surgery was scheduled, it was supposed to be a showcase. Important patient, important family, important press for the hospital. Nathan was lead anesthesiologist. I was lead surgeon.
Everything was documented, logged, and filmed per hospital protocol for high-profile cases.
It wasn't. When the Whitaker surgery was scheduled, it was supposed to be a showcase. Important patient, important family, important press for the hospital. Nathan was lead anesthesiologist. I was lead surgeon. Everything was documented, logged, and filmed per hospital protocol for high-profile cases.
Within a week, the story had shifted. It wasn't about sterile technique or possible OR contamination. It was about me, Dr. Elena Voss, too cold, too focused on the procedure, and not enough on the human being. Nathan was the first to suggest, in a concerned husband way, that my emotional distance might have caused me to miss subtle signs. The nurses who had once trusted me started looking away in the hallways. Administrators who used to praise my efficiency now spoke about team dynamics. My promotion track, which had been all but guaranteed, suddenly stalled. I did what I had always done. I stayed quiet. I reviewed my own notes. I checked every step of the protocol. I found nothing. But instead of fighting the whispers, I let them swirl around me like sterile drape. Because I knew something they didn't. I had started wearing a small personal recording device during surgeries 6 months earlier. Not because I suspected anything, but because I had grown tired of being second-guessed. It was discreet, legal in our state for personal review, and stored securely on my private server. I had never needed it. Until now. The first time I watched the footage from the Whitaker surgery, I sat alone in my apartment with the lights off. I watched it frame by frame. Everything looked normal until the 23-minute mark. Nathan adjusting the anesthesia cart. A small movement that seemed innocent. But when I slowed it down and cross-referenced with the instrument logs, I saw it. One of my preferred curettes had been swapped. Not dramatically, just enough to introduce a microscopic imperfection. Enough to create a nidus for infection if the body responded poorly. The kind of thing that would be almost impossible to catch in real time. My hands didn't shake as I compiled the evidence. I didn't cry. I simply documented. Timestamps, serial numbers, chain of custody for the instruments, cross-referenced with hospital security footage that showed Nathan entering the sterilization area alone the night before. I didn't confront him. Confrontation is theater. I called a lawyer instead. Margaret Klein, a woman known for moving quietly and striking precisely. We met in her office above a quiet bookstore. She listened without interrupting as I laid out the timeline. When I finished, she leaned back and studied me. "You're not looking for revenge," she said. It wasn't a question. "No," I replied. "I'm looking for the truth to be stated plainly in rooms where it matters." She smiled slightly. "Good. Because revenge is loud. Truth is surgical." We filed the defamation and professional negligence suit 3 weeks later. Not against the hospital first, against Nathan personally, and then the hospital for failing to properly investigate. The reaction was immediate and ugly. Nathan's supporters painted me as bitter, a woman scorned by divorce who was now trying to destroy a good man's career. The hospital administrators circled the wagons. Even some of my colleagues who should have known better stayed silent, or whispered that maybe I really was too cold for leadership. I kept operating. I kept showing up. I kept my voice low and my hands steady. The discovery process was where the ground began to shift. Margaret was methodical. She requested full OR logs, personnel movements, sterilization records,
and all personal communications related to the case. Nathan's legal team fought hard, arguing privacy and that this was nothing more than a disgruntled ex-wife's vendetta.
But the judge, an older woman who had seen every kind of lie in her courtroom, granted most of our motions. When the hidden footage and instrument analysis came back, even Nathan's lawyer looked unsettled. Still, they doubled down in their response. They claimed my detached demeanor had created a hostile OR environment, that my focus on technical perfection over team communication had indirectly led to the error. They leaned hard into the narrative that I was emotionally compromised. Still, they doubled down in their response. They claimed my detached demeanor had created a hostile OR environment, that my focus on technical perfection over team communication had indirectly led to the error. They leaned hard into the narrative that I was emotionally compromised. Margaret looked at their filing and actually laughed once, a short, dry sound. They just opened the door, she told me. Now we walk through it.
The deposition day arrived on a cold morning in early spring. I wore simple navy scrubs under my blazer, clothes I could breathe in. Nathan sat across the table with his lawyer, looking every bit the concerned professional. They asked me the expected questions. Why did I seem distant during the procedure? Did personal issues affect my focus? Was I resentful toward my ex-husband? I answered each one calmly, factually, with references to timestamps and logs. Then Margaret took over. She played the relevant section of the OR footage, not the whole thing, just the 30 seconds that mattered. The room went very quiet as the subtle swap became obvious on the large monitor. Nathan's face didn't change much, but I saw the micro-expression, the slight tightening around his eyes that I had learned to read during 8 years of marriage. Margaret's voice remained gentle. "Dr. Voss, can you explain for the record what we just observed?" I looked directly at Nathan for the first time in months. "I believe my ex-husband tampered with my instruments the night before the surgery," I said quietly. "I believe he did it because he wanted me to fail. And I believe he has spent the last several months trying to destroy my reputation to cover that failure." The silence that followed was surgical.
The court hearing itself took place 2 months later. The room was full. Hospital board members, several surgeons, nurses who had once avoided my eyes. Thomas Whitaker's family sat in the back, watching carefully. Nathan's lawyer tried to salvage the situation. He argued that even if the instrument had been mishandled, it didn't prove intent. He tried to bring the conversation back to my personality, my coldness, my lack of emotional engagement with the team. I was called to the stand. I didn't raise my voice. I didn't cry. I simply told the truth, step by step, the way I would walk a resident through a complex procedure. When the opposing lawyer tried to provoke me, asking if I hated my ex-husband enough to ruin his career, I looked at him for a long moment. Then I asked the only question that mattered. "Is that what you believe?" The lawyer faltered. The judge raised an eyebrow. In the gallery, someone let out a soft breath. I continued, voice steady. "Because if we are going to talk about belief instead of evidence, then let's be clear about what we believe. I believe in the surgical record. I believe in documented chain of custody. I believe in what the footage shows. What do you believe, counselor? And more importantly, what does the evidence show?" The judge sustained my lawyer's objection before I even needed one. The settlement came 3 days later. The hospital offered full restoration of my position, back pay, and a formal apology to be placed in my file. Nathan's medical license faced review. The Whitaker family received proper compensation and, more importantly, the real explanation. I accepted the hospital's terms on one condition. The full findings would be presented at the next department meeting. No sealed records, no quiet backroom deal. They agreed.
On the day of the meeting, I stood at the front of the conference room in the same navy scrubs I had worn to the hearing. The room was packed. Nathan was not present. He had taken a leave of absence. I didn't give a long speech. I simply showed the relevant evidence, explained the technical findings in clear medical language, and then looked at every person in the room. I have spent 12 years earning your trust through my work, I said. Not through warmth or charisma, but through consistent, excellent care. Some of you chose to believe a story instead of looking at the data. That is human. But now you have the data. I will continue to do my job exactly as I always have, quietly and competently. The rest is up to you.
6 months later, I was named Chief of Orthopedic Surgery. I still wear my grandmother's watch. I still run my thumb across it when the world gets loud. But now when I walk the corridors, the nurses meet my eyes again. Some of the younger residents have started asking me to teach them, not just technique, but how to stay calm when people try to rewrite your story. Nathan left the hospital. Last I heard, he was practicing in another state. I don't follow his career. I don't need to. Sometimes patients ask me why I seem so steady, even when cases are difficult. I tell them the same thing my mother taught me. Do the work. Let the truth do the talking. And never confuse silence with weakness. Because silence, when used correctly, isn't absence of sound. It's the moment before the scalpel finds the right plane. And the truth, like a well-executed surgery, may take time. But when it comes,